For 25 years, we saw rising drug overdose deaths. We know it is the opioid crisis. First it was prescription painkillers, and then heroin, and then fentanyl and other synthetics. But something unprecedented has happened recently. Overdose deaths started dropping. And not just by a little bit, but they dropped by a huge amount, 25% nationally and 50% here in North Carolina. It's not just opioids. Deaths from cocaine, meth, or polysubstance overdose are down as well. What do we know about it? What do we still need to find out? And if this is truly one of the biggest public health successes of my lifetime, how do we make sure that this progress keeps up? To answer all of these questions and more, I turn to the Street Drug Analysis Lab here at UNC. Nab Dasgupta, thanks for meeting me here.
My pleasure.
I wanted to talk to you because you're a street drug scientist, you have decades of experience in this topic, and I really wanted to know, is this decline in deaths real? Did we change how we're measuring something?
That's a really good question. But let's be clear, first and foremost, that too many people we love are still dying. This isn't like a full celebration, but there is reason to be optimistic. What we see consistently is that overdose deaths have started declining in every single state in the country, starting in about 2021. And the reason we know that this is real is because we see the same pattern in 911 calls, we see it in emergency department visits, and we also see it in the mortality as well. So altogether, we're fairly certain that this is not just a blip.
You say 2021?
Isn't that surprising? It caught us off guard. And part of the reason why we haven't known until now is because the process for autopsies to be completed takes so long that the data are delayed.
So why do you think this is happening?
So it's going to be multiple things that are working together. To start with, let's look at what it's not. So there's a lot of conjecture that it could be law enforcement actions and preventing drugs from getting into the US along the southern border. But all these declines started before any of those actions really went into place. What makes more sense is when we look at the geographic patterns, we see that different states started declining at different times, spread over these 3 years. And so there isn't one national policy that can explain that kind of geographic variability. One of the most obvious things is that the antidote for overdose, naloxone, has been distributed in huge quantities throughout the United States. And that is for sure saving people's lives. But it's not the only thing that's happening. There's been increases in drug treatment. There's been all sorts of changes in the drug supply itself that could maybe explain some of these patterns.
Yeah, so what about drugs that are not opioids, like cocaine or meth?
Cocaine and methamphetamine are also on the decline in terms of their involvement in overdose deaths. So it's not just opioids, it's all of the major drugs involved in mortality declining at the same time.
I want to ask you a little bit about what your lab does in testing these drugs and understanding what the drug supply looks like.
Traditionally, we don't know what's in the drug supply until it's too late, when people are either dead or they're arrested. There's no opportunity for prevention and no opportunity for recovery. So we test drugs in a rapid way and return results back to frontline public health programs and individual people so that they can make better decisions about what they put in their bodies.
So what kind of changes are you seeing in the drug supply?
One of the most surprising ones is an additive. It's a veterinary medication and a sedative that's called xylazine. And don't get me wrong, it causes terrible skin wounds when it's mixed in with fentanyl. But it also makes people use less fentanyl. It's fewer rolls of the dice. And that is something, the geographic pattern of which the spread of xylazine is very similar to where we see the overdoses declining first. So that's one of these paradoxical, counterintuitive things that the drug supply may have changed in a way that makes it so people are less likely to die from that product.
This has been a great success, but what do we need to keep doing?
What is different about this moment now than in the last 30 years is that there's a groundswell of people who are on the front lines taking care of people who have problems with addiction. And this is effort that is happening in every county across the country. And it's public health, it's schools, it's churches, it's the entire community responding to this large-scale societal problem. That's what we need more of. That's what needs to continue, because that's the only way that we're going to be able to address the next crisis that comes along and make sure we do our best to finish this one off.
Thank you so much for talking to me today.
Yep, you got it.
More needs to be done to help people in addiction recovery when they're ready. But keeping more people alive is a crucial first step that seemed impossible only a year ago.